Hi everyone, it's Beatrice here, and today I thought we'd go through a little bit of an overview of the different aspects of academic medical education. So, some of you might be fellows or residents or new faculty who enjoy teaching but not really sure where else you can take that. You might be looking at some courses or certificate programs, even maybe a master's. You might be looking at trying to get into some research and not really sure what the different options are. So what I did for today is I came up with 5 big buckets included within medical education that we can go through just to get a sense of what the different facets of medical education are, where there's some opportunities for research or academic dialogue, some of the different areas you can choose to work in as well. Because for each of these, there are people who that's their main focus within medicine. Now, just a point of clarification, I do have medical education here on the screen. By medical education, I mean the process of training physicians to be independent consultants, right? There's also health professions education, which generally includes all of the healthcare disciplines: nursing, physiotherapist, occupational therapist, dietitian, physician assistant. All of those tend to be within the realm of health professions education, but a lot of these domains overlap, and we're going to see that in a moment. So the first bucket I have here is admissions. When we think admissions, often we're thinking about the selection process of choosing which of the students, which of the lay students, is going to be admitted into medical school and started on the journey to become a physician. And that's certainly part of the admissions process, a big part. There are people who that's their main focus or part of their job. In terms of the academic discussions around this process, right now there's a lot, for example, about burnout. We know burnout is important and a major player in medical students, residents, fellows, faculty, independent physicians. We're also seeing now burnout in pre-medical students, which is a bit concerning because if you think about that burnout, that exhaustion from just the process of applying and trying to get into medical school, how does that set someone up for a future career, right? And these are things we have the answer to. I'm just trying to give you an overview and some examples of some of the discussions that happen. Selection criteria, right? How are we deciding who gets into medical school and ultimately then who becomes the doctors of tomorrow, right? Related to that, principles of equity, diversity, and inclusion. Are the physicians that we're training and the physicians we're putting out into practice reflective of the communities that they're serving? Are certain populations having unfair advantages or disadvantages compared to other populations? Now, when we're speaking about admissions, it's not just admissions to medical school. We're also looking at admissions to postgraduate training. Sometimes even people will include, fellowships or how different practices or institutions will select which physicians will work there. For example, in Canada, United States, residency admissions is usually through a rank-based match selection process. And there's a lot of work that goes into that. There's a lot of academic discussions and debates around that too. Another aspect of admissions you could consider is retention in the field. How are we setting people up for success, right? Are we teaching our students? Are we setting people up with resources to have sustainable careers that they can find joy in, rather than careers and career paths that they're going to burn out from? Because ultimately, that can lead to attrition from the field, which for the future of healthcare is not something that we really want to see happen. So that's a world run through admissions. Next one we can look at is curriculum. And again, for curriculum, this is something that people can really focus in on. There are people whose main focus is just the curriculum. When we're talking about curriculum design is a very big thing. There are courses around this, certificates, even degree programs that you can do just in curriculum. And this, in a nutshell, is how we're going to teach what we're teaching, right? What's the design? What's the layout? Are we going to teach biochemistry first or microbiology first, right? And how are we going to teach these things as well? Are we going to have lectures? Are we going to have small group sessions? Kind of the big picture blueprints of the way that the program is going to be taught, and you're going to get the knowledge into the students' heads. Kind of related to different aspects of curriculum that are popular right now, technology, right? Technology in medicine and medical education. Some of the bigger ones that I can think of off the top of my head, artificial intelligence, really big in the world right now, and medical education is no exception. Simulation as well, especially in certain fields like maybe more procedural fields or running codes, code simulations, etc. Virtual reality as well, really coming up in the medical education space. Other things as well, less technology focused, principles of equity, diversity, and inclusion, as well as decolonization and accessibility. These are principles that there's a big push to try to incorporate into medical curricula. Patient voices, elevating the patient voice, as these are the people that you're training the young physicians to take care of, right? Global health and climate change, especially I think since the COVID-19 pandemic, we're realizing more and more that the world is connected and we are connected to the world. The health of the earth impacts our health. The health of others around us also impacts our health. And making sure that we're incorporating these teachings into medical school curriculum. Social determinants of health as well is a big one. Economic factors playing into health, right? Disparities within certain populations, financial. Well, I said economic. It's the same as financial. But there's a whole aspect of medical education and medicine as well, centered around these different topics. Medical humanities. This is another big one we're seeing. Incorporating reflective writing or narrative writing, or reading the reflections or narratives of patients in order to understand their experience. One area I find particularly interesting is using improvised theater techniques, improv theater, to teach communication skills and flexibility and quick thinking strategies, right? There's a lot of intersections and a lot that you can play around with. Interprofessional education is also a big component of any curriculum. So this is understanding that physicians do not work in a silo, right? They work with nurses, they work with physiotherapists, occupational therapists, dietitians, social worker, nurses, if I didn't say nurse already. And teaching physicians and the others how to work with each other is very, very important, right? Understanding the scope, understanding the role, understanding how to work together. But how do you do that? These are the questions for people interested in academic medical education. All right, moving around the wheel, assessment. Again, another huge topic, huge, huge, huge. How are we deciding if the learners are learning what we want them to learn? Now, you may have heard these words before, formative and summative. A formative assessment means that it's for the learner's own learning, right? It's feedback to help them grow and improve, but it doesn't ultimately affect their progression through their career path, their training, whatever they're going through. Summative, on the flip side, this is something that matters, right? There is a grade, you need a certain grade to pass. So, for example, a board exam is going to be summative, whereas a practice OSCE, right, a practical exam, that's for practice, you get feedback but no mark, that's going to be formative. How do you balance formative versus summative? Is there a certain exam type that is more well suited to one versus the other? Is there an ideal balance or number or ratio between the two? Again, questions that people are exploring in medical education. If you're watching this video, you may have heard this acronym before, CBME, Competency-Based Medical Education. A number of years ago, there was a push towards this, rather than having solely time-based progression through medical education. What if we made this competency-based instead? There's a lot of academic discussion about this, how it's done, how it should be done, and we won't go too much in it. Again, I'm just giving a bit of an overview here of all the different flavors or all the different facets in medical education. Feedback, another huge topic. How is feedback given? How is feedback received? What are the different kinds of feedback? What are the different ways to give feedback? And which one should we be doing at what time? Going around the wheel here, experience. I couldn't think of a better way to say this. This is my personal favorite area, learner experience and learning environments. So we know medical or medicine is a pretty high stress field, right? There's a lot that goes on that's difficult, especially if you're a learner, you're trying to get your bearings, you're not really sure what's going on. They're very challenging and difficult situations that we find ourselves in, often on a daily basis, right? How are we creating learning environments that foster learning and foster safety for the individual so they can get a sense of what's going on and be prepared for independent practice while at the same time feeling protected enough that they can still grow and learn and flourish, right? How do you strike that balance? And there's a lot of different things that go into this. Kind of related side of this is wellness, burnout, and resilience. So I mentioned earlier in the video that burnout in medicine is a huge problem. How are we training or how are we teaching resilience and wellness strategies? How are we teaching young physicians to take care of themselves? Also, how are we paying attention to this during what is a very, very intense training process? Learner support and mentorship, another big category. Many programs, many schools will have formal supports for this, more informal supports for this as well. You could throw in coaching and advising here too if you're in a setting that might be applicable for you. Another big category is crisis management remediation learners in distress. So distress from a number of reasons, right? Learners in difficulty, learners who need a little extra help on certain topics or certain disciplines. Remediation can be related to coaching as well. And crisis management kind of has a number of facets to it as well. I remember going to a workshop at a conference where the focus was natural disasters and medical trainees. So, you're in a place that has hurricanes, tornadoes, blizzards, etc. How do you prepare your medical learners for this? And how do you respond? How do you support them through that kind of an event? Professional identity formation. Again, another idea, another concept related to the learner experience. How do you take a layperson and make them an independent practicing physician, right? There's a process, there's a change that happens where they stop being a layperson and they become a physician. How does that happen? What are the steps to that? Are there things that help or hinder that? And is there a desirable way for that process to go? Is there a less desirable way for that process to go? Professional identity formation. Last little point around the wheel, teaching practices. So when you're thinking about medical education and teaching, this may be what actually came to mind for you. The actual teaching. How do I teach? How do I facilitate a small group? How do I give a didactic lecture? How do I teach at the bedside? There are many resources out there to help you with this. There's even some on my YouTube channel if you're interested in looking. Along those lines, there's a difference between undergraduate, so the medical school, and postgraduate teaching, right? The lessons or the objectives or the way that you're going to teach a first-year medical student is going to be different than a postgraduate, fifth-year resident, for example. Clustered in teaching practices would also be faculty development or continuing professional development. Remember, medicine is a field where lifelong learning is absolutely necessary to keep up with all the advances and all the changes in medicine. And under the realm of medical education, faculty development definitely has a role. Moving on, I know people who work in engagement and motivation. I find it quite interesting, so felt it was worthy of some screen time here. We spoke about burnout, we spoke about resilience, we spoke about wellness, etc. Medicine is challenging, right? The medical training can be quite arduous. How are we keeping students engaged in learning, right? What are their motivations to learn? Are those the motivations that we want them to have? How can we keep students motivated to move forward, to focus on the right parts of the curriculum, right? Not so much the less desirable hidden curriculum. And how can we keep them engaged and enjoying the practice of medicine? Accreditation. I always have trouble saying this word, so that should tell you I don't do much work in it. But every medical school, every training program, needs to be approved by a board, right? There's a process. There are periodic inspections of programs, of schools. There's certain metrics that they need to pass. And again, this is a whole area, a whole process. There will be whole committees focused exclusively on accreditation, if that's something that you're interested in. And then I have topical issues. So depending on the field you're in, there may be issues that are unique to you or your discipline that other disciplines may not have. An example is operating theatre culture for surgeons, right? That's a very big topic, a very hot topic. In pediatrics, maybe vaccine hesitancy, for example, right? So depending on your discipline, there may be issues unique to your own practice, the medical practice, but also medical education practice. For example, how do you teach a resident how to manage or handle a patient who comes in with vaccine hesitancy? Last but not least, there were a couple points that I couldn't quite put in any of these 5 buckets when I was thinking about things, so I've kind of just stuck them here at the end. One is the scholarship of medical education. So I mentioned in the beginning that you might be interested in medical education research. That in itself is very fascinating. I might be a bit biased here, but absolutely fascinating area where you can tackle a number of questions about anything that we've just discussed. As a side note, and this might warrant a video on its own, in medicine we're often talked about quantitative research. So this is the research where you are looking for the truth, you're looking for the answer. You're going to use a lot of statistics, a lot of numbers, right? What is the p-value? I've said before I work in oncology. Does this drug work better than the other drug? Yes or no? Which one is better? Pick one. Right? This is quantitative research and certainly has its role. Now, the thing we have to remember about medical education is it's medicine, yes, but it is education, which often lends itself to a more qualitative side. Qualitative research is about constructing truths, understanding. We understand that situations are dynamic, that people are dynamic, that things change, right? Depending on the people, depending on the context, depending on the time. It's very hard often to answer medical education questions using a purely quantitative approach. For example, if I want to know if teaching strategy A is better than B, well, a large part of that is going to depend on the context, right? The way that I would teach a first year medical student the microbiology they need to pass their board exam is going to be different than the way I would teach a second year pediatrics resident how to counsel a patient about vaccine hesitancy would be different than how you would train a 4th-year surgical resident on an advanced operating theatre technique, right? Qualitative research is often about constructing truths, constructing understanding, or reaching understanding. It might involve speaking with people, right? It might involve observation. It might involve looking at written documents. And it's a very fascinating field, but if you're interested in medical education, I would encourage you to try to learn a bit more about qualitative research, because it's not infrequently that I see very good questions that are attempted to be answered quantitatively, and I think that you can lose a lot of the richness that comes with a field as dynamic as an educational one. I think last little point here is also educational leadership. So this is another facet, whether it's chief resident, program director, you want a position in a medical school as a dean or something like that. How do you acquire those skills, right? How do you acquire the knowledge to be able to carry out that sort of the duties or role of that sort of position? And again, there are whole courses on this, there's whole programs on this. Educational leadership is a very big topic on its own. So I hope this was helpful for you. If so, would love it if you would just drop a comment about any future videos that you might find helpful, and hope to see you in the next one.